Good morning. It's nice to be on this call with all of you from PEB. This is the virtual presentation for PEB pre-65 retirees who are just coming into this wonderful Medicare marketplace. So I love being able to do this presentation. Actually, I've been with VIA Benefits for 11 years now, and we usually get to see you in person. We get to travel around the country and do presentations live and see your faces, but this year's a little different, so we wanted to make sure everyone was safe. So this year we've had to do virtual presentations. So it's amazing to me how important it is for all of you to be on this call and to get this information. I know how important this is to you. And so as we go through the presentation today, I'm going to go through a couple of housekeeping items. First of all, I've shown this little slide a few times, but if you've just joined the call and you're seeing me, but you can't hear me, there's a way to check your volume on your computer. So there's a panel on the right-hand side. The red arrow will bring it away from the side of your screen a little bit bigger. If you click on the audio line, it brings up computer audio, phone call, and no audio. If you click between computer audio and no audio, it should fix your volume. If it doesn't, then just click on the phone call button and it will give you a number that you can call where you can just hear the audio portion as you watch the slides. There's another way to watch this over and over again, because I'm going to give you a lot of information today, and I know you're not going to remember it. We don't expect you to. Right here in the middle of that panel, there's a line that says questions. During the presentation today, I want you to be able to ask questions. I'm going to give you a lot of information, and there are sort of sections about different things, and I know you'll have questions, but if you would actually wait and listen to the presentation as we go, you'll be able to understand a lot more, because you will be able to see this again. But if you want to ask questions, if you click on that questions line, and now right here on this little square that has the line through it, if you click on that, it brings it out bigger on your screen so you can type in whatever question you have. We have a staff of people, including Nicole from PEB, who can type the answers back to you. So anytime during the presentation you feel that you need to ask a question, make sure that you type it into that questions bar. Now, this is the part I always think is important, because today is a live meeting, but after today, you may want to watch this again, or even certain parts of it. So there are actually two ways you can do that, and you can watch it as many times as you'd like. If you go to my.viabenefits.com/PEB, you'll be able, as you go to that landing page, about halfway down, you'll notice that there's a link, and that link will say PEB Retiree Medical Video Presentation. All you have to do is click on that, and you can watch this presentation over and over again, as many times as you'd like. There's another way. You can go to peb.state.nv and .us. So if you go to that website, also there will be a link on there that says for the presentation will be posted, and it shows you there how you can watch that again. So there are two ways for you to watch this over and over. So that's why I said, if you'll just sit back and listen today, you get more out of it than when you're trying to furiously write down a question. You miss things. So it'd be great for you to be able to listen. Now, what we're going to do today is go through who we are as VIA Benefits, and we'll talk about Medicare, and then of course how you can enroll and when. Now, there's different plan types, which I want to go over with you today so that you feel better about your choices, how we can help you, and then your HRA, the subsidy that PEB gives you. So we'll discuss a lot of that, and then your next steps on what you're supposed to be doing next. You know, as seniors, and I am one of those seniors, I am on Medicare as well. It's our biggest concern about planning for retirement is our health care. So I know this is very important to you. So to begin with who we are, VIA Benefits, this is a very good company. I've been there for 11 years, as I said, and I found them because of my mother. I was trying to help her. So it was great to know that they were there, but we are the first and the largest private Medicare marketplace, which simply means We're not an insurance company, but we've partnered with over 120 different insurance companies so that all your choices can be in one place. For those of you that are just turning 65, have you noticed all the mail you're getting? I mean, a ton of it from all these different insurance providers. There's no way you could understand all of that. So all of this has been brought into one place. So now all you have to do is talk to us or go to our website. You can see all their different plans and all their different prices from one standpoint. So this is an important part. This is our 15th season of doing meetings and working with our specific clients. And we've helped over 2 million retirees move from their group plan to Medicare. And those people like using our people and having us be able to help them. So we're really proud of that. So we're excited to have you join. We have of course had PEB in the past, but for those of you who are just turning 65, welcome. Now, what we want to do today is make sure you understand the 2 ways that you can work with us. Number 1, online is a very important part. So remember, my.viabenefits.com/PEB. If you go there, I mean, obviously it's open 24 hours a day, 7 days a week. But when you go on there, you can see all kinds of plans and the information that you may need. Or you can call us and speak with an advisor. And that is Monday through Friday, 5 a.m. until 6 p.m. in the evening. So it's a 13-hour time period that you can call and talk to a real person and get some answers to your questions that way. There's a specific number that you would call, and that is 888-598-7545. That is a specific number dedicated to PEB. So when you call, we know you're calling us from PEB. So this is a very important number for you to keep handy so that you can call us whenever you need our help. We'd love to talk to you. Okay, now I'm going to turn the time over to Nicole from PEB, and she's going to go over some information for you as well.
Hi, thank you, Paula. So I'm Nicole from the Public Employees Benefits Program, and today I will be presenting all the information that's related to PEB. And if you have any PEB-related questions, again, you can type them in that Q&A box, and I'll go ahead and answer those for you. And as Paula said, it's a really good idea to listen as much as you can first, because a lot of those questions you have may be answered as I go along. So approximately 2 months before your 65th birthday, PEB is going to mail you a happy birthday card, a PEB and Medicare guide, as well as a retiree benefit enrollment and change form. You're going to hear me reference this form a lot today, so it's also known as the RBUCF. It's on that slide on the right portion of the slide with the black and red text. It's important to note that this form cannot be a copy. We do need the original form because of the barcode that's on the bottom right. Next slide. So are you eligible for premium-free Medicare Part A? If you or your spouse have worked at least 40 credits or 10 years in any job which you paid Social Security taxes, or you're eligible for railroad retiree benefits, or you are under the age of 65 and approved for Social Security disability benefits, you are eligible for free premium Medicare Part A. If you are not eligible, please do not purchase it. On the next slide, I'll go ahead and discuss what your steps will be. So Medicare Part A covers about 80% of your hospital care, and Medicare Part B covers about 80% of your medical. So you're going to only fit inside of one of these categories. If you have TRICARE, we're going to need your Medicare A and B card, as well as the front and back of your military ID card. If you are an active employee, you are not required to enroll in Medicare until 60 to 90 days prior to retirement. If you are a spouse or domestic partner, PEB's Medicare requirements apply to the covered spouses and domestic partners. If you're currently retired and you're approaching your 65th birthday, you're newly retiring and you're over the age of 65, or you're under the age of 65 but you are approved for Social Security disability benefits, You will enroll in premium-free Medicare Part A if you are eligible, and you must purchase Medicare Part B from Social Security. So on this next slide, you're going to see, again, one of the categories that you'll fit into. So if you have Medicare A and B and you have no covered dependents, you have to enroll in VIA benefits. PEB is going to need a copy of your Medicare A and B card, as well as you'll need to mail in your RBECF form to elect or decline dental. On the next slide, I'm going to go over what the dental coverage is, because for each of these options, you will either enroll or decline in dental. If you're newly retiring, you need to enroll in Medicare A and B 60 to 90 days prior to your retirement. If you have Medicare A and B and you're also on TRICARE for life, you are not required to enroll in VIA benefits. All we need from you is a copy of your Medicare A and B card, as well as the front and back of your military ID. Again, you're going to log into your portal and you're going to elect or decline dental by sending us in the RBECF form. If you have Medicare A and B and you are covering non-Medicare dependents, you have a couple of options. So you as a retiree can stay on the PED, PPO, EPO, or HMO plan with your dependents. We like to call this anchoring in. So it would be your the dependents you have under the age of 65 that will keep you on that plan. Or you as a retiree can enroll at VIA benefits and your dependents can stay on a PED plan at an unsubsidized rate, or the dependents can choose to terminate coverage. You will need to complete your RBECF, elect or decline dental, as well as send PEB a copy of your Medicare A and B card. So if you're not eligible for free premium Medicare Part A, like I said before, please do not purchase it. You are allowed to remain on the PPO, EPO, or HMO plan, and you must purchase Medicare Part B. Obtain your Social Security eligibility letter that says that you are ineligible for free premium Medicare Part A. You're going to log into your portal to complete your event, as well as send in your RBECF form. You're going to submit all your documents to PEB, and your monthly premium will be reduced by $135.50 after we receive your Medicare Part B card. If you're an active employee and you're not yet retiring, you're not required to enroll in Medicare. If Medicare is obtained, you're going to submit a copy of your card to PEB, and if you're on the consumer-driven health plan with an HSA, your HSA will become an HRA and you will no longer be able to make contributions. So we do recommend active employees not sign up for Medicare until 60 to 90 days prior to their retirement. So on this next slide, you're going to go ahead and see what our dental options are. So if you decide to enroll in PEB Dental, your dental plan will look the same as it is as an active employee. You will have your 4 tooth cleanings per year, your 2 bite wing x-rays, and everything else that you're familiar with. If you decide to decline dental, you can enroll in a dental plan through VIA benefits. However, if you ask any benefit advisor, they will tell you that the PED Dental option is the most comprehensive plan. You will be reimbursed. The reimbursement will occur automatically. You don't need to submit a paper claim form. If you have a PERS pension, it's just going to be deducted from your PERS pension. And if you don't, you'll pay online or set up an automatic payment through PEB. You can choose to have coverage as a retiree only. For a state retiree, it will be $40.44. As a non-state retiree, it will be $41.67. If you choose to be to have the dental as a retiree with your spouse or domestic partner, as a state retiree, it will be $80.87, and as a non-state retiree, it will be $83.33. So again, that's just the option that you have to either enroll or decline in dental. We like to say that this process is easy as 1, 2, 3, 4, 5. So the first thing that you're going to do, contact the Social Security Administration and enroll in Medicare A and B as eligible. Next, you're going to send PEB a copy of your Medicare A and B card. You're going to either fax, email, or mail it. We are not accepting walk-ins at this time. Then you will mail PEB the original RBECF form. Again, those forms have barcodes on the bottom, so we will not accept copies. You will then call and schedule an appointment with a licensed benefit advisor and complete your enrollment with VIA benefits over the phone. Lastly, you will wait for your funding packet to arrive from VIA benefits. This can usually take about 8 to 12 weeks from your effective date. Okay, and I'm going to go ahead and hand it back over to Paula.
Thank you so much, Nicole. She always has a lot of information to give you. So I'm sure that that was really a good part for you guys. Maybe you want to hear that again and watch the presentation from the website. Now, I want to talk about the Medicare plan types, just to give you an idea of what you're going to be doing as we go forward. And so you know that you're going to be choosing a Medicare plan. So what we have all the Medicare plans, the Medicare Advantage plans, it's also Part C of Medicare, Medicare supplement plans, which are also called Medigap plans, and prescription drug plans. So those are choices that you're going to be making, and you'll want to know a little bit more about all of these, which we're going to go over. Now, I told you that we have partnered with over 120 different insurance companies, and so as on the slide, I wanted you to see some of them. So obviously, they're not all on there. There's just a few, but you can see these are all nationally known companies. All of you recognize. Now, there will be regional companies as well as the nationally known companies that are highly rated by Medicare that we'll have on our platform. We also have dental and vision plans, as Nicole had mentioned, if any of you are interested in those. The advisors can help you with that, or you can see them on the website. So let's start out with Medicare, and so that we're all on the same page here. Medicare has 4 parts. Usually you just think of Medicare as Medicare A and B. So what happens when you turn 65? Now, if you're, like Nicole had explained, if you're already getting Social Security, you will automatically get that Medicare card in the mail 3 months before you turn 65. But if you're not getting Social Security yet, then you have to register with Social Security to get your card. And in the mail will come this cute little red, white, and blue card. Now, when it comes, it has a big, long number on it. It used to be our Social Security number with a letter at the end. But now they've got this big, long number, and we need that. We need the information that's on that card. So if you don't know where yours is, because some people put it in a safe place and they can't find it again, you need to get that card again. So you need to order another one, but we need that. So that card says that you have Medicare Part A and B. Now, A, as Nicole has said, you earn that by working 40 quarters in your life, or your spouse does. So now you have Part A. Part A covers hospital. Then there's Part B. Now, if you had turned 65 and you are still working full-time and you're under a group plan, even though you have Medicare, you didn't have to pick up Part B because you were still under a group plan. But now if you're moving out of that and you're retiring, you have to have Part B of Medicare. Part B covers doctors and medical. But Part B is not free. You have to pay for Part B. Most people, average amount is $144.60 per month. Now, if you're getting Social Security, you and I both know it comes out of our Social Security check before we ever see it. But if you're not getting Social Security, then you will get billed by Social Security. You need to make sure you're paying for Part B. So now you have Part A and Part B. So now people look at that and they go, hey, that pays 80% of my medical. I really don't need anything else. But you're going to get a shock if you've been in the hospital or you have a procedure done and you see the total bill and you think you have to pay 20% of that. It's too much money. So what people have noticed is that they have to get something that they want to supplement what Medicare doesn't pay. So here's where your choice comes in, because now you're going to have either a Medicare Advantage plan that supplements it, or you're going to choose a Medigap plan. These are the things I want to discuss with you today. I want you to see the differences in these two so that you know how to make the right decision for you. So the Medicare Advantage plan is called an MAPD because it's Medicare Advantage plus prescription drug. They bundle them together in that plan, and you have one card. So when you go to the doctor, you just show them that one card and they bill the insurance company. Or you'll choose a Medigap plan that doesn't include prescription drug. You have to add that as a standalone plan. So a Medigap plan, you would actually have to carry your socials or your Medicare card plus your Medigap card. But when you go to a doctor, you hand them your Medicare card because they bill Medicare, not the insurance company. Medicare bills the insurance company. So it's very interesting the differences in these two plans. Also, you'll have the option of non-Medicare benefits, which are dental, vision. There's all kinds of things that you'll have as optional benefits that we'll discuss in a few minutes. So this is kind of how it looks as you're going forward. Now the two different plans, Medicare Advantage and Medigap, that's a pathway. It kind of splits. You have to choose one or the other. You can't have them both, so you have to choose one or the other. So let's talk about the differences in these plans. First of all, a Medicare Advantage plan that includes prescription drug. I know you're very well aware of these because they're called HMOs and PPOs. Now, HMOs are restrictive. You have to go to their specific doctors and hospitals, just like Kaiser. So you have to go there. If you don't go to them, then you're not covered. So if you travel a lot, this type of plan will not travel with you. Now, if you choose the PPO part, then the PPO plan allows you to go in or out of the network. So if you travel a lot or live part of the year somewhere else, then that plan would actually give you the ability to be covered. But if you're out of the network, you're going to pay almost double. So you have to be careful. So the thing to remember with Medicare Advantage plans is, number one, they are network based. So you need to remain within the network to get the best costs. Now, number two that I want to bring up about Medicare Advantage plans is they are inexpensive on their premiums. I personally have one of those plans. My plan is a $0 premium. It's a $0 deductible. When I see my primary care physician, it's a $0 copay. I really love my plan. But you have to remember that Medicare Advantage plans, even though they're very inexpensive up front, you're going to pay later with these. So keep in mind that this is a pay-as-you-go plan. Here's what I mean by that. If I see my primary care physician, it's a $0 copay. But if I see a specialist, now I have to pay a $50 copay. And if I end up in the hospital, I have to pay about $350 per day for the first 5 days that I'm there. After that, if I'm there longer, then the insurance plan picks up the rest of the cost. But I have money that I have to pay out of pocket if I'm sick. So keep in mind, these are network-based, and you're going to pay as you go with these types of plans. There's also the optional benefits that some of these plans include. Now, this has only happened this year, which has been really good. Insurance companies, some of them, have added these optional benefits like hearing aids, vision, dental, and again, they'll bring food to your home for free. They'll take you to your doctor's appointments for free. I mean, these are really good benefits that have been added. But keep in mind, not every plan added those. So as you're looking online, I'm going to show you how to figure out which ones have added these new supplemental benefits and which ones haven't. So remember, this is important. So also, there's one other thing that I love about Medicare Advantage plans. They started a program called Silver Sneakers, and I love that because it pays my membership in a health club so that I can go over and I can exercise, and then my membership is paid for by my plan. So these are really fun things about this plan, but keep in mind that they are pay-as-you-go. So this is a Medicare Advantage plan. Now let's go to the Medigap because there's big differences in these plans. A Medigap plan is regulated by Medicare and the state that you live in. So the state of Nevada has a lot of things to say about this plan. Insurance companies have no say on how Medigap plans cover us. So when you look at a Medigap plan, I want you to think of this. Number one, they're going to be pay up front. So you're going to pay it all in the premium. So these are higher premium plans, but there won't be any costs later. So this is the pay up front plan. And Medigap plans are letters of the alphabet. They start with letter A and they go all the way through letter N, and every one of those plans cover you differently, which I'm going to show you in just a second. But I want to bring up some points here. People like Medigap plans because there's no network, which means those of you who travel a lot or you live part of the year in another state, this would travel with you. So you can go to any doctor in the United States of America. As long as they accept Medicare, you're covered with that doctor. So you can go to any doctor as long as they accept Medicare patients. So this has been a real popular plan for those types of people who travel a lot. Now remember, you have to add the drug plan to this because none of them include a drug plan. So you're going to add a separate drug plan, and we have many of those to choose from. So I want to show you something that will help you remember about Medigap plans. This is a wonderful graph because look at this graph. It shows you all the Medigap plans. Along the top is all the letters of the alphabet, and then underneath each letter, it shows you how these plans cover you. Now, this is a great graph to have, and all of you have this already. Do you remember getting this book? In the last little while, we got our new one for 2021. It's called the Medicare and You book. This is such a great book, but nobody reads it. We all get it and put it up on a shelf and think, oh, we've got our Medicare and You book. On page 72 this year, that graph is on page 72. It's always in there. It's just on a different page. So when you look on page 72, you will see this graph. It won't have the colored parts. We put those on there just to kind of accentuate a couple of things. First of all, the blue ones. These are the bookends of Medigap, which means the A covers you the least and the G covers you the most. And so it kind of shows you the difference in how these plans cover you. Now, if you look over on the right-hand side, there are two plans that are green, highlighted in green, the C and the F. Now, here's what happened this year. Medicare decided they did not want to pay for the Part B deductible for these plans. So, going forward, if you were not 65 years old or Medicare eligible by January 1st of this year, you no longer have the option of choosing a C or an F plan. Before this year, the F on these was very popular because it was the most comprehensive plan that you could get in Medicare. It covered everything. So you paid your premium and everything else was paid. No deductibles, no co-pays. When you're in the hospital, you pay zero. So no surprises. You just paid your premium. So it was a popular plan. And if you were 65 by January 1st of this year or Medicare eligible, you still have the option of choosing a C or an F. You can still choose those. But if you weren't, then the most comprehensive plan that you can choose is the G. Now, the only difference in a G and an F, only one difference is, remember, Medicare's not paying the Part B deductible any longer, so you have to pay the Part B deductible. The Part B deductible is $198 per year, which comes out to be about $17 a month. So as you look at the G is very comparable to the F, other than that Part B deductible. So this is a great graph to have. As you're looking at that, you can understand what's going on. Now, those of you who've been online, and I know you're computer savvy, so you've been on the website and you've looked at plans because all the new ones were released the first part of October for the 2021 year. So if you're looking at them and you look at the G plans, you'll notice there could be 6 or 7 different companies that offer the plan G, and they're all different prices. And people get confused about that. And so people will call and they'll say, well, which one's the best? Because, I mean, this one's $200 more a month than this G, so the G that's more expensive is obviously a better plan. Absolutely not. Please understand this. A G is a G is a G, period. It doesn't change. Insurance companies have no say on these plans. None. They have no say on how that plan covers you. That's done by the state and Medicare. So they can offer you that plan, but they get to charge you whatever they want. So if it were me, I would look at the G and I would get the one that's charging the least amount for that G plan, and I'd get that one because the insurance companies have no say about these plans. None. Now, I want you to know something about these plans. We are in the Medicare annual enrollment period. Excuse me. And if you are not in a special election period, so if you're not a person that is moving from their group plan to Medicare, then you will not have a guaranteed issue on these plans. See, when you're enrolling in Medicare Advantage, you will always be guaranteed issue, which means no questions asked about your health. So it doesn't matter if you have a pre-existing condition. But Medigap plans do that only during this special election period. So let's say this year you chose a Medicare Advantage plan like I did. And then later on, a couple of years down the road, you're not healthy anymore. So now you want the Medigap plan. So you call and you say, now I want to enroll in the Medigap plan. You could go through underwriting now, which means they're going to ask you the health questions. Do you have high blood pressure? Are you diabetic? Are you someone who with a heart condition? They're going to ask you those questions, and they could raise the price or they could deny you on that plan. So it's important that you know these rules. Now, Medicare Advantage, you can move from that. Every year you can change your Medicare Advantage plan, and there will never be questions asked. But Medigap plans can underwrite you after this year. So this is something to think about. Now, here's what I'd like to remind you about. We all, if we choose Medigap, have to choose a drug plan. So here's something I want you to think about with this. You're going to choose a drug plan, and all of them have different formularies. So when you're looking at them, what we're trying to do is help you find a drug plan that charges you the least amount for whatever drugs you're taking. And everybody's different on what type of prescriptions they take. So we want to ask you to give us the prescriptions that you're using right now so we can put them in our system and find the one that's charging you the least. To give you an example, I'm going to use the drug Lipitor, and the generic for that is atorvastatin. Let's say that you put in our system that you take atorvastatin and this dosage and whatever, how many times you're taking it, and you will see all these different insurance companies and how much they charge, and they're all different. Some may charge a zero copay, some may charge $5, some may charge $12, some may charge $35. Same drug, but insurance companies have their own formulary where they categorize your drugs. So very important, really interesting to make sure that you're giving us those or putting them in your profile if you're going online and setting that up. So there are 5 tiers of copays. Your drug that your prescription is about is maybe a preferred generic, or it might be a non-preferred generic, or maybe a preferred brand or non-preferred brand. It could even be a specialty drug, and they go up in price as this list goes down. So we want you to be able to look at your drug plan each year. Now, let me tell you something with these. When you want to change your plan each year, you do not have to re-enroll in any of these plans. If you like your plan, it will automatically roll over every year. Especially with Medigap, once you enroll in that, you're in for life. They can't ever kick you out of it, no matter how sick you get. But it's something you want to check on every year is your drug plan, because your drugs change and the drug plans change every year. So this is something you might want to do each year is check your drug plan. Now you have a drug plan, and during the year, there are different levels that you could fall into. So let's walk through what could happen. So let's say your drug plan has a deductible, or maybe it doesn't have a deductible. So it could be anywhere from $0 a year all the way up to $445 a year. So you could have that deductible. Once you meet your deductible, then you move into the initial coverage level. All this is where you pay a copay for your drugs. You go to your drugstore and you pick up a prescription and pay a copay. But the insurance company does keep track of the retail cost of that drug, not what you paid, but they're keeping track of what the retail cost is. So on the right-hand side of this little graph, it's showing you the retail cost. When it reaches $4,130, you are going to move out of that level of coverage and go into the coverage gap, or what we call the donut hole. Now, I don't want you to worry about this, because during initial coverage, that level, 75% of us never leave that level. That's where we stay all year. But there are people that take more expensive drugs, and they may move into that coverage gap or the donut hole. 25% will reach that. But here's where you don't pay copays anymore. Now it moves over to just a percent. So now you will pay a flat 25% of whatever drug you pick up, whether it's a brand name or a generic. You will pay a 25% amount. The rest of that, which is 75%, is paid by the insurance company and the drug manufacturer. That's what happens during the donut hole. So I don't want you to worry so much about that. See, over here on the right-hand side, you're looking at these big numbers. That's not what we pay. That's what they're just keeping track of, how much those drug costs are retail. So when it hits $6,550, you will leave that initial or the coverage gap and move down into catastrophic coverage. That's the last level. And only 4% reach this level. But in this level, you're only paying $3.70 for generics and $9.20 for brand name drugs, or 5%. So think about it. The insurance company and the drug manufacturers pay 95% of the cost, and you're going to pay maybe up to 5%. So this is something that I wanted you to kind of understand how the year goes. Now, you do not need to remember this. Your advisor can go over this with you, and every month you will get a letter from your insurance company explaining where you are and how that fits into what your prescriptions are. So you'll know way ahead of time about that. Okay, now the next thing I wanted to do was let's talk about what we want you to do as far as working with us. We want to make it simple. Prepare. So you're kind of in an area where you're preparing, getting your information together, your doctors, your prescriptions, that type of thing. Now you're going to review plans. So we're in the part where all the plans now are on the website, or the advisors can tell you about all of them, and you're going to review all the plans that that might fit you in deciding what you want to have, and then you're going to enroll in the plan. So simple, prepare, review, and enroll. So during that prepare part, you can go online and create an account, and I'll bet many of you have already done that. So you just go online. It's really easy, and it's kind of fun to use the website. So when you go on there, we'll need your personal information, like your name and your email address and your telephone number. And if you have a spouse, you can both be on one website. You don't need two. You can both be on there. So now you've got that information. Then we need your prescription drug details, like the name and the dosage and the frequency. And then we need your Medicare ID number. You got to have that big long number and your name and that type of thing that's from your Medicare card. And then you need your doctor's information. Because if you're enrolling in a Medicare Advantage plan, like the one I have, we need to make sure that your doctors accept that plan so that you don't have to change doctors. You want them to get it. You want to get a plan that they accept. So we need your doctor's information. But if you're enrolling in a Medigap plan, we don't need your doctor's information because you can go to any doctor in the United States of America that accepts Medicare. So this is important. So this is the type of information that you can put on there. Now, when you want to schedule an appointment, so your appointment for enrollment, you can go online and schedule it on the calendar that's on the website, or you can call and speak to an advisor. And you can call Monday through Friday from 5 a.m. to 6 p.m. Pacific time, and you know the number, 888-598-7545, or you can go online at my.viabenefits.com/PEP. Now, you received an enrollment guide in the mail. Now, this one is not the picture that you have on yours, but you've got this guide. There was some really good information in here, basic information about Medicare. In the back, there's a really good question and answer section that's nice to read. And so you got this. Now, it also gave you the name, the phone number, and the website. So that information was basic information. You do not have to have this enrollment guide in order to enroll in a plan. And some people say, well, what if I go on my enrollment call and I'm not ready to enroll? You don't need to enroll on that call if you're not ready. You can think about it and call back when you're ready to enroll. You don't have to enroll on that call. Okay, now, I want to go over the website with you just a little bit because it's really a fun website, and we've really enhanced it so that it's really fun to use, easy to use, and easy to understand. So you go online and you get there and you put in your information, so you've got your profile there, and then you can go in and compare plans side by side. And if you'll notice, it shows all their premiums, what they're charging. It shows all the benefits for each plan side by side. And remember, I was explaining about the special benefits that have been added to these plans. When you click on a plan, like this one's Aetna, it'll bring it out bigger, and you can see at the bottom, it'll say optional benefits available. Always check those because all plans are not the same. Some of them add these special benefits like the hearing and vision and dental and all of those things, and some don't. So click on that where it says optional benefits, and it will show you. Now, for those of you who hate computers, and I know there's some of you out there, then just call, and the advisors will go through the plans and which one has those optional benefits. then there's a place online that says help me choose. When you click on that, it walks you through a series of questions to find out which type of plan will probably fit you the best. And so it'll bring that up. It's a great little thing to go in there and review that. Then there's a place for you to put in your own drugs. Now, on the website, if you want to add them, you'll need your name, the dosage, and the frequency. So just get out the bottles or whatever you're using so you can get the exact information off of that. And you can load them yourself. And every year you can go in and check to make sure that you're in the right plan. And it will really help you with that. So it will show you all the different drug plans and the prices depending on which one you choose. So that's a really good option for you to do. Now here's where I think this is really interesting. You can actually enroll in your plan online. You don't even have to call us. It will say, do you want to enroll? And it's like shopping on Amazon. You put it in the cart. It walks you through each step that you need to do to enroll. Now, another thing is some people just don't feel comfortable doing that, and I get it. I can understand that you want to talk to an advisor and have them enroll you, which is wonderful. You need to just call and have us do it. And then again, that number is 888-598-7545. And the new plans are now available on the website. Now, if you want to speak to an advisor, I want you to remember that our benefit advisors love to talk to you. They love to help. So when you call in, these are licensed, certified, and appointed advisors. The average age of our benefit advisors is 43. And the reason I say that is because we have people who are mature. They've been in there, a lot of them are already in Medicare. They know how to answer your questions. They're really good at it, and you'll probably get attached to some of them. And yes, you can talk to the same advisor every time if you'd like. These people do not get paid a commission when they enroll you in a plan. See, some people think that they might put you in one plan over another because the commission's different. It's not, but our people are salaried employees. They are not commissioned. So I want you to feel really comfortable about that. And of course, we're a 100% domestic workforce. See, we're all in the United States of America. So if you're thinking about where am I calling when I call this company, you are calling either Salt Lake City, Utah, where I am, or Phoenix, Arizona, or you're calling Dallas, Texas. Those are the three areas of the country where our service centers are. And our advisors are people who live in those areas. So now you know they speak English, so you can call them and talk to them. I'm really proud of our people that we have in our office that do that, and they are so good at it. So you can call anytime between at 5 a.m. and 6 p.m. in the evening. That's Pacific time. So Monday through Friday, we'd love to talk to you. Now, when you enroll, you're going to get this in the mail about a week later. It's a confirmation letter that just says, here are the plans you enrolled in. It's like a receipt. I want you to make sure you check that. If there's anything on there that you're not sure about, be sure and call us because we can change it. We can change it, your plan as many times as you'd like until December 31st. So this is a very important part. Then you'll receive that. Now, we are here all year, not just now. We're always going to be here to help you. So I want you to think during the year, if something comes up, let's say with an insurance company about a claim, or maybe there's a prescription that somebody's not covering, now you need to call us and say, I need you to fix this. See, we can call the insurance company for you. You don't have to call them. That's what we're there for. So use our services. They're free, so you might as well. So we're always going to be there to help you with anything that might come up. Now, remember this period that we're in. We're in the Medicare open enrollment period, which is October 15th through December 7th. Every year, that's when you can change your plan. If you're changing from one Medigap to another, I will warn you, yes, you could go through underwriting. So once you're enrolled in a Medigap plan, there's really no reason to change it. Now, this provides you an opportunity to change your plan, but especially your prescription drug plan. So changes that are made during this time period are effective January 1st. So any of you that are enrolling in a plan right now, your effective date is January 1st of 2021. So if you want to make any changes to your coverage, you must make your changes through VIA Benefits. This is very important. Making changes outside of VIA Benefits will cause you to forfeit your monthly HRA. You do not want to do that. See, we've had people 1 year enroll with us, and then the next year they go directly to the insurance company. They go, well, now I'm just going to do it through them. You'll lose your HRA if you do that. See, what you don't realize is whether you enroll directly with an insurance company or through us, the price will be exactly the same. The difference would be that you would lose your HRA. And I know you don't want to do that. And not only that, you'll lose your life insurance and PEB dental if applicable. So important. So then there's another enrollment period called the Medicare Advantage open enrollment period. And that goes from January 1st through March 31st. Now, I don't want you to think that you missed open enrollment. You didn't get enrolled by December 31st. So now you can enroll January 1st through March 31st. No, it doesn't work like that. What this is for is it provides the additional safeguard. Let's say you enrolled in the wrong Medicare Advantage plan and you learned it after you had it start January 1st. So then they're saying you can switch from one Medicare Advantage to another Medicare Advantage that would work better. Or you can switch from Medicare Advantage or disenroll from your Medicare Advantage plan and just go back to original Medicare with a standalone drug plan. So this is for people who made a mistake, enrolled in the wrong plan. So this open enrollment period will not help those that didn't enroll during the special election period for this year. So it's very important for you to make sure that you don't miss that enrollment period. Okay, now let's talk about the HRA. And I'm going to turn it over to Nicole one more time so she can explain this to you.
Thank you. So we offer two different types of HRA. We have the Consumer-Driven Health Plan, the CDHP or PPO HRA, and it's funded on an annual basis on July 1st. It's funded according to the participant tier, which is $700 per retiree and $200 per covered dependent with a maximum of 3 dependents. This is the same HRA as if you were active. If you're still on the PEB plan as a retiree, then your HRA will remain the same. Once you transition to VIA benefits, remaining funds are no longer available. This is really important because if you currently are on the consumer-driven health plan and if you have an HRA, when you make that transition, any funds will revert back to the state. So we recommend that you use those funds before you make that transition. Again, if you are on currently the EPO or HMO plan, you don't have an HRA, so you don't really know what I'm talking about. So you're good to go. When you transition over to VIA benefits, your HRA will be funded on a monthly basis. It's funded according to your years of service. We begin at 5 years and we max up to 20 years. There is no bought years taken into consideration. And a big plan design change that did happen is that effective May 31st, 2021, there will be a cap on the available HRA balance of $8,000. So before, your funds would roll over from year to year, and if they exceeded $8,000, they would still remain on your account. But as of May 31st, 2021, that your funds will roll over from year to year until they reach $8,000, and then any extra money will revert back to the state. Next slide. So how is your HRA funded? It's funded according to your years of service, like I mentioned before. So if you have 5 years of service, you will receive $65 a month. And if you have 20 years of service, you will receive $260 a month. Your HRA is going to be established automatically once you enroll in a qualified health plan through VIA benefits. And you're going to receive a funding kit packet. Once you receive that welcome kit, your funding will begin. We have a lot of participants who are wondering why their funding hasn't started right when they enroll on a plan. And like I mentioned before, you need to wait that 6 to 8 weeks. Next slide. So your health reimbursement arrangement, it's a tax-free account and you'll receive it if you are eligible and qualified. And I just realized this is Paula's slide, so Paula, if you want, you can go ahead and continue explaining the HRA.
Thank you very much, Nicole. I'll be glad to do that. Now, the HRA information, just so you know, because some people are confused about what is an HRA. It's a health reimbursement arrangement account. But what you need to remember is it's a reimbursement. So you are responsible for paying your premium to the insurance company. See, under PEB, if you were having it taken out of your pension check or however you were paying, that no longer will be the way it's going to work once you enroll through Via Benefits. So the HRA, you are now going to be reimbursed after you pay the insurance company. So it's a tax-free account, which is why it was set up that way. And I'm sure some of you do know how these work, but it's used to reimburse you for eligible health care expenses. So if you are eligible and you qualify, PEB will make a monthly contribution to a health reimbursement arrangement. Then you may use those funds to reimburse yourself and your spouse for anything eligible, like medical, prescription drug, dental, and vision premiums, Medicare Part B. That's another thing that people like to get reimbursed for, your premiums for Medicare Part B, as well as eligible out-of-pocket expenses like co-pays and co-insurance, that kind of thing. Now, the HRA is typically created within 6 to 8 weeks after your qualification. So let's say you call and you enroll in a plan. It's going to take 6 to 8 weeks for that to make sure that that's all qualified. Unused HRA funds are available in future years. Unused, remember, they roll over. And then as Nicole just mentioned, they're not going to let you build up more than $8,000 in that HRA, which is a lot of money. You need to be using that for your premiums and even if it's your Part B premium that everyone has to pay. So subject to, now this is something I want to bring up. It says a 365-day rolling reimbursement. That means if once you've had something happen, like if you're in the hospital, you have 365 days to get reimbursed for that. After that, it won't be. It'll be past the time period. Okay, so the next thing I want to make sure is that you know, as we've been discussing this, when you enroll in a plan through Via Benefits, that activates your HRA. But you must remain enrolled through Via Benefits to keep your HRA, or you'll forever forfeit your rights to that. So see how important it is for you not to go outside and enroll somewhere else, because I know some people are tempted to do that. But remember, the plans, the prices are exactly the same, but you want to keep that HRA. So make sure if you change it that you do it through Via Benefits each year. So here's the PEB reimbursement options. Now here's something that I'm going to let Nicole, if that's okay, Nicole, I'm going to let you make sure. I'm not sure that I'll just go through this with you. So there's auto reimbursement. So you enroll in a participating plan on the Via Benefits website or through an advisor, and that activates that. So you're going to pay your premiums as required, but then we're going to reimburse you automatically without you sending us anything, any receipts. Then there's the recurring premium reimbursement form, which some of you, like if you want to get reimbursed for Part B, but you don't want to send in any kind of receipts every month, you'll do it for one time. You'll do it the first time, and after that it will automatically be reimbursed. And then you have this one-time manual reimbursement, which I'm going to explain to you in just a second. So let's go through this and it'll make more sense. You call in to Via Benefits, this is you in the yellow, and you say, I want to enroll in this plan. And so when you do this, you are going to learn to pay your premium directly to the insurance company. But some people don't want to send checks every month or however you might want to pay that. So they have the insurance company automatically take the money out of their account and send it directly to the insurance company, whoever you choose. So that makes it easy. You don't need to worry about it every month. It's going to be taken care of. So the bank takes the money out of your account, sends it to the insurance provider. Now what happens is the insurance company does not send you a receipt. They send that to Via Benefits. We've set that up with the insurance companies. So some send it weekly. They send us a file. And on the file it says, here's who paid and here's what they paid. And so that's the receipt, but it comes directly to Via Benefits, and then Via Benefits can turn around and direct deposit your money right back in your account. So here's how it works. Comes out, the bank takes it out, and we put it back in from your HRA. So it makes it really simple. As long as there are funds in the HRA, we can automatically do that, and it works like clockwork. It's just really nice to have that done. Now, here are some eligible expenses. This is under the 213D under the IRS. So all of these things can be reimbursed. We won't go through this whole list, but it is online, and it is, when you watch this presentation again, you can see all of these things. There's a lot of things that you can get. This is not an all-inclusive list of eligible expenses. So just to give you an example, this is the reimbursement request form, just to give you an idea of this. So anything that you pay out of pocket that isn't a premium, you would use this form. So this would be for a co-insurance or a copay, or your prescription copays, or eyeglasses and contacts. So this is something that you would use to get reimbursed for those, and you would do that once a year. Now, you obviously you're going to be able to do this online, but there are other ways that you can do that as well. So if you do it online, this is such an easy way to do it. When you go in and set up your profile, you'll notice there's a place that says funding. So when you click on that, it'll take you to your HRA, and it will show you the amount. Now, obviously, it's not there yet because this doesn't start until January 1st, but you'll be able to go in there. There's the amount that you have in your account. It'll show you anything that's gone through and you've been reimbursed for. You'll also get information from Via Benefits saying this is what's left in your account. This is a great way to check it. And you're going to like this. For some of you who do everything on your cell phone, there is an app for Via Benefits. It's called Via Benefits Accounts. So you can download the app and do everything from your phone. You don't have to be on a computer. All of it's on your phone because the phone is a computer. So now you'll have that app, but it's not available until January because that's when your funding will start. So now you'll be able to get on the app on your phone. Okay, now I'm going to go over a few plans and the premiums because I know we do this each year, and I want you to know that Carson City and Reno are the same. So I'm just going to show you Reno. For those of you in Carson City, it's the same. It hasn't changed. So I'm just going to go touch on the highlights of some of these. Like in Clark County, you'll have 29 plans available that range in price from $0 to $151. Medicare supplements, 24 of those that range in price from $47 to $261. And then Part D, prescription drug plans, there's 22 of those that range in price from $7 to $95. So there's a lot of choices that you're going to have. You also have 5 vision plans and 12 dental plans that you can look at or you can compare, but you've got a great plan through PEB, those of you who have that. And then, of course, this is just a Medicare Advantage plan, and it just shows you how that works. It's like mine. It has a 0 premium. It's a PPO, which allows you to go in or out of the network and still be covered, but you pay more out of the network than you do in. There's no deductible. There's a $5 copay at your primary care physician and $35 for a specialist. And if you're in the hospital with this one, your first 5 days are $295 a day. So it shows you how this plan actually is a pay-as-you-go plan. And then it has the prescription drug plan on the bottom. And you can also see these if you go on the website. Now, just to show you, a plan F would be $168 a month for a 65-year-old male, because these plans can be priced by age or gender or even community rated. That's $161 a month plus a $7 prescription drug plan. We have prescription drug plans this year that are a $7 a month cost. It's amazing how these drug plans have come down in price. I just am impressed. So you'd pay $168 a month and you pay nothing else, and you can go to any doctor you choose. That's the plan F for a 65-year-old. And you'll notice on the bottom, the drug plan I added is the $7 a month one. It has a $445 deductible per year, except for generics, the tier 1. And then it shows you how it's a $0 premium for a preferred generic, and goes on from there. And then you have mail order on all of them. Then this is the G, so that you can see the difference. It's $163 a month, and the F was $168. So it wasn't that different for a 65-year-old. But remember, if you're just turning 65 and you weren't 65 by January 1st, you can't choose an F because they're not available. So $163 a month, but you have the $198 deductible. So this is why I wanted you to see the difference in that, which is about $17 a month. What you're seeing on the screen in the circle is a Plan G can be anywhere from $140 a month up to $161. So this is why I said the Plan G is a G, period. I'd get the one that's the least amount. Okay, now, these are for the Reno and Carson City areas. There's 16 Medicare Advantage plans available, 24 Medigap, and 22 prescription drug. But the Medicare Advantage range from 0 to 180, the Medigap range from 47 to 233, and the prescription drug range from $7 to $95. You also have the 4 vision plans and 10 dental plans to choose from. And this one is a $0, but it's an HMO. So remember, the HMOs are the restricted networks. So this has a $0, $0 deductible. The doctor copay could be from $0 to $10, depending on the doctor, and the specialist is $50. But when you're in the hospital, you pay $275 a day for days 1 through 6. These are just examples. There are many more examples. We're just using this as an example to show you how that would work. And it shows you the drug plan on the bottom that has a $0 deductible, and the copays would be $5 all the way up to 33% for the specialty drugs. Now on this one, same thing, you pay $168 per month for a Plan F if you were a 65-year-old male. Again, you would pay nothing else. And then the Plan G is $153 in Reno and Carson City. So it's less than the people who live in Nevada, in Las Vegas. So as you'll notice, the $153 a month is for the Plan G, and you have the deductible one of $198 per year, and so that works out to be $17 a month. And again, the range would be $130 to $161. Isn't that interesting that insurance companies can change how much they charge for this plan, and it's exactly the same plan. So it just shows you kind of the range for that. Okay, so the next steps, really easy. Get your Medicare card out. Remember this card, you got to have that one, and then make sure that you schedule a call with us. But when you call in, they'll ask you that. That's one of the most important parts, is that Medicare card. Or you can go online and you can put all your information there. Contact us at 888-598-7545. And it's as easy as 1, 2, 3. So this is a great thing to remember. 3 months prior to your 65th birthday, you contact Social Security and apply for Medicare Part A. Or if you're getting your Social Security, it will automatically come. After you receive your Medicare Parts A and B card, please send PEB a clear copy by mail to 901 South Stewart Street, Suite 1001, Carson City, Nevada 89703. Or you can email it to memberservices@peb.nv.gov. Also, mail PEB the original retiree benefit enrollment and change form, that RBECF, to enroll in or decline PEB Dental. No faxes or emails of this will be accepted, of that form. Remember that. Now call via benefits at 888-598-7545 to complete your profile and schedule an enrollment or an appointment with a licensed advisor. You may also set up your profile online at www.my.viabenefits.com/PEB and shop for plans. It's kind of fun to do that. And then remember to have your Medicare card, your preferred doctor's information, hospital information, as well as your current prescriptions ready when you set up your profile. Then call Via Benefits and complete your enrollment over the phone. Remember to ask Via Benefits to automate the HRA, the reimbursement process, as much as possible. You can also enroll online at the my.viabenefits.com. And then Via Benefits will mail you a funding account welcome kit about 6 to 8 weeks from your plan effective date. So you'll be getting that. Don't forget to set up your direct deposit if you wish to do so. Okay, now you can contact PEB at the Public Employees Benefits Program. Now this is all this information that you already have, but it's on this slide. So and there's the Via Benefits information. If you want to talk to Social Security, it's just ssa.gov. So that information I know is very important to all of you. So it is on the slide as well. And remember, you can watch this on that website at my.viabenefits.com as many times as you want, or you can also go to the PEB website. Now, this is what I want you to do. Go online, my.viabenefits.com/PEB, or call us. Now, the presentation is actually at an end, but before I do anything, I want to thank all of you that were on this call. I know how important this information is to you. I know this is a kind of a hectic time, but it's so important for you to be able to understand all of this. So if you make sure that you watch it again and again until you feel comfortable, hopefully this helped a little bit to show you what's going to happen going forward. But I appreciate you giving us the time today, because I know your time is very valuable. But I'm going to leave this screen up for a few minutes because I know you'll still have questions. And some of you listened to the presentation and then waited till the end to ask questions. And I thank you for doing that because you get more out of it. So remember, Nicole is on the call from PEB, and she can answer questions back to you, and so can our team of people. So I'm going to turn my face off the screen and put me on mute. And please feel free to continue to ask questions. We'll keep this up for a few minutes so you'll have the time to do that. Thank you again for joining the presentation. Have a great day.